You want to check to see? I think we're live. Are we live, Randy? Text me if we're live. All right, so this is Dr. V, founder of BreastCancerConqueror.com and the 7 Essential System. I'm here at the Hope for Cancer. Yep, she's watching. Hey, Randy. Hope it looks good. So I'm here at the Hope for Cancer Center in Cancun, Mexico. And I met Dr. Tony. This is Dr. Tony, by the way.
Hi, everyone.
I met Dr. Tony through The Truth About Cancer and absolutely fell in love with him and his beautiful wife, Marcy, because of the principles that he teaches, because of the heart-based therapies and approach to healing cancer. And what I really appreciate about the center and the reason why I bring women here is because, first of all, they look at the whole body approach. It's not just all about the supplements and the therapies, but first and foremost is the emotional and the spiritual aspect, which in my belief system, I think that is the primary issue that needs to be addressed, especially if you're on a journey with cancer.
And in addition to that, Dr. V, there's actually been scientific studies now. They did two groups randomly of cancer patients. Two groups randomly of cancer patients, and one group was prayed for and the other group was not prayed for. And the group that was prayed for did significantly statistically better than the group that was not prayed for. And of all spiritual beliefs, right? So it's not about one religion. This is about the spiritual aspect of the human being. And then, of course, the emotional aspect is vitally important as well.
So powerful, so powerful. So a few months ago, last June, I decided that I wanted to bring women to Cancun so they could experience the benefits of being in a very healing environment, a very safe environment. You know, we think of Mexico and we think of, oh, is it going to be safe? You know, where am I going to go? Who's going to pick me up? Well, when you come to the center, everything is taken care of for you. You have your drivers and, you know, everything is taken care of for you. So that's the first reason why I started bringing women here to these small retreats so they could be introduced to Dr. Tony and the center. The second reason I wanted to come is because of my own personal experience. Can I zoom out a bit? Okay. The second reason was because of my own personal experience. Some of you may not know that I went through a second healing journey. Most of you know me through my first journey, 2004 through 2006. And in 2015, cancer came knocking on my door again. And that was a big aha moment for me. Here I was, the breast cancer conqueror, and yet I was facing breast cancer again. So how could that be? Well, it really made me revisit my life, revisit the 7 Essential System, and it really taught me a lot. So for the last 3 years, I've been on my own personal healing journey again, but this time with a very different approach, newer technology and better therapies. So I was able to pass on that information to all of you and to the community. And so when I came this time, I wanted to do one of the new technologies that Dr. Tony brought from Germany. It's called the PDIS, which basically is a very thin laser catheter that is inserted inside the vein, and it literally counts any type of circulating tumor cells as the blood circulates through the body. And if there are some that are detected, then it can zap them with the laser treatment. So it's a twofold treatment, detection and then treatment. And I'm very happy to announce that my results were just perfect. Nada, not a one, no circulating tumor cells. So very, very excited and very, very grateful for that technology. So I'm going to move the platform over to Dr. Tony. I'd like for him to share a few comments about the PDIS and some of the therapies that they offer here. And if you have any questions, feel free to go ahead and send in your questions, and we'll try and answer them as we go along. So, Dr. Tony, go ahead.
Well, the first thing is I'm so happy and excited for Dr. V because when we screened for circulating tumor cells, there weren't any detected. And that is amazing because it validates in a way, in a very important way, all her work, her teachings, her compliance, her dedication, not only to you, but to herself. Because often as healers and practitioners, you know, we say and we recommend and we teach, but then applying it to ourselves, it's a different story. So this is such a great validation, and you can take Dr. V as a great example, right, of her mission and her passion and her willingness to come to Hope for Cancer and to learn and to do these therapies like we all are. We're all learning, we're all developing new therapy. But the PDIS, or photodynamic infrared spectroscopy, is a brilliant, innovative technology out of Germany, and non-invasively or minimally invasive, it detects any circulating tumor cells. The circulating tumor cells are the ones that lead to metastasis. So if you or a loved one has breast cancer, and maybe they're in remission, maybe they're unsure what their status is now because they're in that watchful waiting period, it's very important to look at circulating tumor cells. When circulating tumor cells are non-existent, the likelihood of metastasis is barely zero. If there are circulating tumor cells, then that's when we have to be even more proactive and not only detect them, but also treat them. So this technology is wonderful. It goes along with the 7 essentials. We have at Hope for Cancer Treatment Centers, we have the 7 key principles, so they merge quite nicely. And the 7 key principles starts from the spiritual, as Dr. V said, the emotional, and then we get into more of the physical applications of the foundational healing therapies in cancer: oxygenation, gut health, and I know Dr. V teaches a lot. The group that she has here at Hope for Cancer and here in Cancun, it's a wonderful group of ladies, and the education that goes along with the stay here, the coming together, right? Because sharing stories is so powerful. The treatments that they're receiving, anything from intravenous vitamin C, intravenous green tea extract, which kills cancer circulating tumor cells. It decreases blood flow to tumors, very important as well. So these patients, some of them are having these treatments here. Some of them more to be proactive and preventively because they're in a phase now of you know, no cancer activity according to CAT scans, PET scans, MRI, and so forth. And others do have active disease. So if any of you know someone or yourself and you're on the limit of what to do, please reach out to Dr. V, because it's very important to take this next step in looking for these circulating tumor cells, following the 7 essentials, and also following the 7 key principles to cancer therapy.
And I just want to add too, there was an 11-year study done on women who had breast cancer, and they found that if women learned to manage their stress and had community support, they had a 79% decreased risk of dying. So that meant that they lived a lot longer. That was an 11-year study. So coming together as a community, meeting other women that are like-minded or on the same journey as you, and understanding what cancer is and what cancer is not, it removes the fear of what cancer is. Because what's the first thing that we think of when we think of a cancer diagnosis, right? A slow, torturous death. Well, we're here to tell you it does not have to be that way. Our goal and our mission is to empower you so that you never have to fear cancer again.
And that's one thing I told the group today. We're actually here at the conference room at our Cancun facility, because we have a Hope for Cancer Treatment Centers in Tijuana also. But here in this very room, Dr. V and I had a session, educational session, one more, right?
Right.
With these people that are here. And one of the things is, as you said, Dr. V, being empowered, not having fear, and having that certainty versus doubt. You cannot heal completely if you have doubt. You have to have that certainty. And the study you quoted, 79%. That's huge.
That's huge. 11-year study.
11-year study.
So that shows you how important it is. And if you understand the mechanisms of cancer and how your body works and what you need to do to support it, then it removes the fear. Because what traditional medicine has taught us that cancer is a death sentence. It's something that you get, that you're a victim of the cancer. And a cancer diagnosis is life-changing. It can cause post-traumatic stress syndrome. But if you understand it and you have trust and understand how your body has the amazing ability to heal and reverse it, that cancer really in the end is a message of love. It's teaching your body, and it's telling you that how you've lived your life so far hasn't worked. Something is out of balance. Cancer cannot grow in a healthy body, period. And so if you have a cancer diagnosis, that means that it's tapping you on the shoulder and it's telling you, you need to change things in your life, because what you've done so far has brought you to that point.
Yes, cancer is not even a sentence. Cancer is a word. So when they say cancer is a death sentence, that's even wrong, because cancer is a word. And so as a patient of ours says, cancer is not the enemy. It's fear, which is the enemy. And so it's important to realize that cancer is a sign, an outward sign of a dysregulation or something that broke down in the body for that tumor, lump, bump, nodule to manifest itself. So the way that it manifested means that now we have to go back and trace from all levels of the human body, from the body, mind, and spirit, which includes, of course, the soul, the mind, the emotions, the traumas, the conflicts. So it's very important. Once we get to that foundational level, then the body heals. And so healing is from within. And it's you can heal no matter. And don't be afraid. If you were told you're in stage 3 or stage 4, usually that's associated with maybe looking like you're in a coffin, but opposite of that. You should see yourself on that mountaintop with your arms up, and I am victorious, because you can be victorious. And both of us have seen this so many times.
That's right. I respect traditional medicine, because it certainly has done some amazing things when it comes to critical care. If you're dying of a heart attack, they do excellent work. But when it comes to health and wellness and cancer in general, there is a lot of misunderstanding there. And I forgot what I was going to say. I had a train of thought about moving towards that. But oh yes, the stages. So I call them doctor's gloom and doom. When the doctor tells you you have a stage, especially as you get to stage 3 and 4, well, what's the next stage? Nothing, it's death. I've even had clients tell me that the doctors would ask them, well, are you ready for hospice? What does that implant into your subconscious mind, that there's no hope? And so we want to reverse that and tell you that there is always hope. And that's why I love, the name of your clinic, Hope for Cancer. And my message is a message of hope, because there's always hope. If there's a breath left in you, and you really have the desire, and you see yourself as victorious and living a happy, fulfilled life, things can turn around. We see it all the time. So never, ever give up.
And words like terminal, they use this in oncology. You're terminal. Well, aren't we all terminal? We're all terminal, right? So even that is a play on words, right? We're all terminal eventually. So first of all, don't believe that. And the belief system is so important, and that felt experience. How did you feel when you were told you have cancer? Who were you with? How was your what do you think would be your next step? So this is so important.
Thank you. Thanks for sending the love, Sandra. I see you there. Sandra's actually here upstairs.
Oh yeah, Sandra's here. Wow.
Yeah. Mm-hmm. So if you have any questions, go ahead and send in some questions if you like. We've got a couple of more minutes to be on the air here. So let's talk about vitamin C IVs. Okay. I know there's a lot of confusion. People think that when they take a vitamin C IV drip that it's, they have to go really high levels, 100 grams, 125 grams. So explain to our audience what vitamin C IV can do for them.
My explanation of vitamin C comes with over 25 years of clinical experience, because many people, and I respect them, most of them, but they write books and they've only treated themselves, right? So the Reardon Clinic, Dr. Tom Levy, a good friend of mine, these are people who have studied vitamin C a lot, and we have also studied it and applied it just like in other centers. So what's important here is to realize that vitamin C is water soluble. If you give vitamin C too quickly, especially at higher doses, you're just going to have expensive urine. So, you know, having 25, 50 grams go into your vein in 30, 45 minutes or an hour and a half, it's too fast. These IVs should take 3 hours. But oftentimes, you know, the doctor doesn't want you there in his office for 3 hours.
Right.
You don't want to be in the office for 3 hours, and then they drip it really quickly. So one of the first things is please have these vitamin C drips slowly, right? Secondly is above 12.5 grams, vitamin C becomes a pro-oxidant that gives it the ability to kill cancer cells. And at a Salford University in England, it was recently proven that vitamin C kills cancer stem cells or circulating tumor cells. This is huge because these are the cells that lead to metastasis. The same cells that, as we talked earlier, we're detecting with the PDIS system. So slow drip, high amounts above 12.5, and the frequency should be like 3 days a week, ideally, in a clinical setting that you should have the IV vitamin C. And on days that you're not getting vitamin C, the liposomal vitamin C orally is the best way to maximize oral vitamin C. And if you cannot do vitamin C intravenously for whatever reason, then please take the oral liposomal vitamin C. Because remember, we're one of the few mammals that cannot produce our own vitamin C. In the wild, when an animal gets sick or has a trauma, it upregulates production of vitamin C maybe 1,000-fold. This has been studied. But humans, we don't have that, so we have to take vitamin C from the outside so it could have the cancer-killing effect, the anti-inflammatory effect, and so many other immune benefits as well.
Excellent, excellent. So somebody was asking about a laser watch. So one of the amazing therapies that are done here has to do with actual laser catheters in the vein, different colors, different frequencies that do different things. So they stimulate the immune system, oxygenate the blood, kill off pathogens. What else?
Increase mitochondrial function and ATP production, increase nitric oxide production. We know how important that is. So there's a wide array of benefits, as you mentioned.
And so when you come to the clinic and you have those therapies done, you also can go home with what we call a laser watch, which it's not really a watch, but it's a laser that you would apply to your wrist. You take a photosensitizer orally, and it sensitizes the cells, and so basically does something obviously not as good as when it's in the vein, but it has a very positive effect.
The basic principle is that energy medicine, which has been poo-pooed for many years, even in 1954, Dr. Gerber wrote a book called Vibrational Medicine. And, you know, nowadays we use energy medicine or energy technology to diagnose, right? Like MRIs, magnetic resonance, PET scan. This is all energy. Even in EKG, we're using energy to detect and diagnose. Even the photodynamic infrared spectroscopy, the PDIS, is energy. But when we use energy to treat, then they call us quacks.
Right.
And we know the importance of light for the human being and for the planet. So we are light beings. So now what we're doing with the laser watch is using light of different colors. These are some of the colors of the rainbow. For some reason, God created light in different color spectrums. So we use red light, blue light, yellow light, green light, ultraviolet, and infrared. And I hope you got all that. But we use 6 different types of light intravenously. With the laser watch, we use 4 types of light. So here in the palm of our, below the palm of our hands, the skin is very thin. We have a rich blood supply there. So when we put the laser watch here, after taking the sensitizer, as Dr. V said, that sensitizes cancer cells, we need then the light, the photons, this light energy, to also go after those cancer cells and increase ATP production and so forth. So I use the laser watch almost every day. I should use it every day, but I use it preventively. So the teachings that Dr. V gives you, the education, and that we provide at Hope for Cancer, it's not only when you have cancer, it's to prevent, decrease your risk of developing cancer, and also if you're in remission, to keep it that way. So the laser watch is a very effective, useful tool. You could just use it while you're at home. It comes also with earpiece, a nose piece, and a pad that you could use topically in different locations.
Yeah, and I'm leaving here with one, so I'm very excited. Can't wait to try it. So somebody had a question about, is vitamin C helpful even if you have bone mets?
Yes, yes. Vitamin C is a very highly absorbable molecule, and it helps also pain. It's anti-inflammatory, so in addition to killing the cancer stem cells and helping bone health, it has that anti-inflammatory effect and that pain relieving benefit that surely someone with bone metastasis can use.
Yeah, very good. Well, Dr. Tony's on a tight schedule. I'm on a tight schedule. I've got to run upstairs and hang out with the other divas that are here. So thank you so much for watching. Please stay tuned. I'll be doing a Facebook Live every week to answer all of your questions, and we'll be posting them on YouTube afterwards. But looking forward to seeing all of you, and share this with your friends and family. You can save a life by teaching people that they never have to fear cancer again. This is Dr. V and Dr. Tony live from Cancun, sending you a big healing heart hug. Bye-bye.
Blessings. Bye-bye.